welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And today, for our topic, we're going to be talking about self-treatment. And some of the things that in self-treatment are, people buying over-the-counter drugs such as Advil, Tylenol, those kind of things. Not advocating for brands, but we're just talking some of these over-the-counter drugs. And also some of the at-home remedies. I know in my culture, in the Hispanic culture, they use a lot of hot tea with lemon or Vicks Vapor Rub on everything. And was just mentioning to us about putting Vicks Vapor Rub for athletes, which is not what it's for. Please don't do that at home. But what are some of the things that you've come across? I mean, just kind of bringing this into the conversation.
Well, first of all, when we talk about self-treatment, Alex,
Mm-hmm.
we're talking about non-prescription drugs. We're talking about over-the-counter drugs that you can get in a pharmacy,
Mm-hmm.
in some cases in a supermarket.
Right.
Over-the-counter drugs are approved by the Food and Drug Administration based on safety. They are not approved based on effectiveness.
Right.
However, many drugs that are now sold over the counter used to be prescription medications. So drugs like Claritin and Allegra and Advil and ibuprofen and naproxen, all of this, they used to be on prescriptions. You get the benefit of the effectiveness from the prescription standpoint,
Mm-hmm.
but you get the safety from it being available. Now, safety means that you're following the directions on the box. If you think that it says 1 tablet a day and you think therefore, well, I could take 2 or 3 or 4 a day, that's a really bad idea, because then you begin to get into potential problems with toxicity, potential drug interactions, things like that.
So you gotta use as indicated on there.
Use as indicated.
Exactly. Yeah. So and what it could, you just mentioned that it could lead to potential dangerous outcomes. What are some of the common ones that we come across?
Well, I don't know about everybody's family or M's or yours or otherwise, but I know that friends and family of ours have had problems where they've taken too much acetaminophen, which is Tylenol,
Mm-hmm.
and they've had liver failure. We know that they've taken too much of ibuprofen, which is an NSAID for pain, and they've gotten kidney failure. Well, these are very common. If you take too much of any of the NSAIDs, then you're putting the patient, the individual, at significant risk of kidney disease and maybe kidney failure. And if you take too much acetaminophen, you put them at significant risk of liver. What does that mean? Clearly there are numbers that everybody uses. About 3,900 milligrams of ibuprofen. Above that is toxic.
Mm-hmm.
When you're dealing with acetaminophen, there's about 4,000 milligrams, but nobody's trying to test it as an over-the-counter self-treatment.
Right.
What you're trying to do is to use it for a short period of time to treat a given condition. You have to have the condition, you have to have identified what the problem is, and treat it, but treat it for a short period of time. It's not for treating it forever.
Right.
And you have access to information. Clearly, you can go to the internet.
Mm-hmm.
There are 1,000 books about it, and clearly, your local pharmacist in every pharmacy can help you with what to look at, what to take, how to take it, etc. So you have a lot of resources.
Yeah.
But you're dealing all the time with short-term problems, acute kind of issues that are relatively short in duration, for a day, 2 days, 3 days, frequently no more than a week or so.
Right.
And that. So that's the important thing.
And you mentioned they have resources such as online resources, and the one I want to bring up, and I think it's important that we bring up, is WebMD.
Mm-hmm.
Now, WebMD has been it's very popular. A lot of people use it. My wife uses it. A lot of people use it. But the problems that come from WebMD are people tend to self-diagnose from WebMD, and it could be self-diagnosed in a very dangerous way, where they feel like they have a certain thing, and then they take the wrong thing, and then that leads to more problems. Like, how can one avoid those type of?
Yeah, I don't want to call out just WebMD. There's a whole host of places you can go.
I use them as an example.
Mayo Clinic, WebMD,
Yeah.
a host of different places. The fundamental issue here is the following. People want to try and self-treat. And by the way, this is not just a U.S. issue. It's true across the world.
Right.
They don't want to go to a doctor. They don't want to pay the doctor fees. They don't want to go to the emergency room. They don't want to have to pay for the fees. They want to be able to do it themselves.
Right.
Solve the problem, and everything is copacetic. The important thing to address here is
So it's only that easy, right?
Yeah. the important thing to address here is if you have a particular problem, you've got two areas. One is I have pain, I have issues with an allergy or a cough and cold, I have issues potentially that are topical on my skin that I can potentially treat, that are short-term issues. The things I should absolutely never treat is I should not treat where I have what I think is a cold, but now I have significant headache pressing from my skull, pressing on my eyes, big sinus congestion. That needs to be evaluated by a doctor because that may be a bacterial infection, not viral.
Oh, wow.
The second issue that you have to address is pain. You're dealing with short-term pain. If something is acute, you hurt yourself or you cut yourself or something, the pain should not be significant for more than 2 or 3 days. If it begins to extend out where you're having pain for a week, 2 weeks, 3 weeks at a time, that needs to be evaluated because it should not go on that long.
Right.
And things that are on your skin, if it's something that you can treat, it's not eczema or psoriasis, but it's some sort of a blotch, or you hit it, or you've got a bruise or whatever, and you want to put something on it. Once again, these should not last for longer than a week or so, because if they do, then once again it needs to be evaluated. And if you're on an NSAID or aspirin or something like that, then you may be bruising because you're on those medications, and that needs to be evaluated.
Right.
So you can't just say, I'm going to do it and I'm going to read about it, therefore I know everything, therefore I'm going to treat myself. We have to know the things that are serious that we cannot treat ourselves.
Right. And so what about some of the self-treatments that come without buying over-the-counter drugs? So how about, like I mentioned, Em was talking about one of her family members tried to treat Vicks VapoRub with try to treat athlete's foot with Vicks VapoRub and claims that it works. It doesn't work.
Yeah, Vicks VapoRub. God. Vicks.
Hey, for Hispanics, Vicks cures just
everything.
About everything.
Oh, yeah.
It doesn't, by the way. Please don't comment.
This is
on
kind of like the Greek wedding thing where everything is getting spritzed with Windex.
Yeah,
right.
That doesn't work.
Or one of our staff members was away, and the people that he knew were giving everybody Sudafed, which is a horrible idea, especially for people who have high blood pressure. They're going to make it worse. So there's some things that are just a really, really bad idea. With regard to the Vicks VapoRub is a counter irritant. What it does is to draw fluid so that it's a drying agent, and it irritates the membrane so that the membrane is dropping fluid out so it dries up.
Right.
It is not NOT, an antifungal drug. It is not an antibacterial drug. It's not for athlete's foot. It's not for anything other than perhaps a cold. And if you're using it for something else, then you really need to have that other thing evaluated so you get the appropriate therapy.
Yes.
Not that. Now, to be fair, I came from a family, and you've mentioned it, and so have others. So it's Hispanic, it's Jewish, and it's others. Hot chicken soup, tea with lemon and honey.
Yes.
Classic treatments for a cold. The reality of it is you get a cold, it's going to last 7 days no matter what you do.
Right.
And so, yes, the chicken soup works because everything works because the cold is over in 7 days. But it's great,
right,
so
right.
you get something you want. So that works.
Right. So some self-treatments work, some you can't figure out where the hell they came from. But what type of symptoms would be a clear sign that you would need to go to the doctor? Now, this question is brought up because, like my family, we didn't grow up with a lot of money, or even some cases insurance. So we would try to avoid going to the doctor as much as possible. You know, hospital costs are increasing, clinics even cost a lot. So you want to avoid these things, but there are certain times where you're going to have to see a doctor. I mean, there's no way around it. What are some symptoms that are clear signs that are common, but clear signs that you should get evaluated? You mentioned some earlier, but...
I did. Let me just go through them real quick.
Right.
If pain is going on for longer than a week,
Right.
then clearly you need to have something evaluated to find out whether it requires further evaluation by a doctor, a nurse practitioner, physician assistant, etc.
Right.
And clearly you can go to the pharmacist to get an evaluation as well.
Mm-hmm.
The second thing is that if you have a cold, but you have what I was talking about with significant headache, pressing on the eyes, pressing on the sinuses, that's something that needs to be evaluated because it may be bacterial, not viral.
Right.
If you have something on the skin and that skin does not doesn't seem to go away within a few days,
Mm-hmm.
and is lasting longer than a week or two, then most definitely it needs to be evaluated as to what it is and deal with it, because it may be that you're on some medications that are causing the problem.
Okay.
And therefore you need to be careful with how you handle it. The other kind of things are medicines that you take to make you feel good. So there are, or even to help you, drugs to go to sleep.
Right.
Drugs to go to sleep over the counter generally are diphenhydramine, which is an antihistamine.
Mm-hmm.
So if you're having trouble sleeping after you've been taking it for a few days, then yes, you need to have it evaluated and see whether it requires some further therapy or there's some other reason that doesn't require drug therapy.
Right.
In order to address it, because we tend to overuse sedative hypnotics. If you're significantly anxious, I don't mean just anxious because your boyfriend broke up with you or because you woke up and your Rice Krispies didn't go snap, crackle, and pop this morning, but you are anxious and you're constantly anxious.
Because you need to finish a report really fast.
That's right. Well, the key feature here is, can you deal with the activities of daily living?
Right.
If you're avoiding the activities of daily living, then you have a problem and that needs to be evaluated. Same thing's true of depression. If you're depressed all the time, with two key factors. One is you've been depressed for a long time, for multiple weeks, and that needs to be evaluated. And two, if the person is depressed and is so depressed that they begin to talk about ending their life, suicide, and they have a plan for it, then those people
Right.
most definitely need to go see a physician. There
Or
are
if
some
not,
drugs.
if you find somebody that is talking like that, please see a physician, talk to somebody, try to get that person help. It's a
Right.
big problem going on now.
It is a
Yeah.
big problem.
Yeah.
Other issues, of course, are with opiates, and the issue of opiates obviously are prescription medication, but people tend to see that there are additional problems they have. So,
Right.
for example, they're on antidepressants, they can't sleep, they're anxious. That's usually a choice of which antidepressant they're using, because some of them make you anxious, and anxious at night so you can't sleep.
Right.
Opiates frequently have other problems associated with them with regard to anxiety, sometimes depression and otherwise, and people tend to treat those other problems.
With opiates, yeah.
And so as a result of that, those things need to be evaluated. There's a host of things that need to be evaluated, but the most important thing is, if you're going to treat with over-the-counter, it's something that you have researched, you've talked to a pharmacist, you've dealt with whatever on the internet, etc. But it needs to be short-term. It needs to have a specific endpoint. And
Right.
more than a few days, more than a week or so, that needs to be further evaluated.
Right. So that's all for today, and I hope you got some great information from Dr. Stern. And if you have any other questions, please feel free to leave a comment below or message us directly. Some things to take away just from our conversation today was treat over-the-counter treatments just acutely, like within a week, say 3, maybe 7 days, and then after that, you may want to get evaluated if the symptoms persist longer than that. Once again, feel free to comment or below and message us directly if you have any other questions, comments, or concerns. And also visit propharmaconsultants.com. We have a free information page called RxInfoX, and we will see you next week.
Well, hold on.
Oh, wait.
We're going to be traveling next week.
Oh, okay.
I'm going to be traveling, so we won't have one next week,
Okay.
but we will the following week when I get back.
Okay. So we'll see you in 2 weeks. If you like this video, hit subscribe. If you like the pretty little hearts around my head, hit subscribe.